art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory forever. Amen. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
I think Mr. Bob said that he called this morning that Mr. Gomes' brother passed away. Uncle. His uncle passed away. So he's not here, and then Curtis Lissy passed away over the weekend. Keep all those folks in their prayers. Going to item 2, public comment. Luke Copperdick from San Antonio River Authority.
Thank you, Judge.
Thank you.
Morning, Judge Commissioners. I just want to make an announcement of the San Antonio River Authority, Wilson County, and the Alamo Resource Conservation Development Area are teaming up for another Wilson County household hazardous waste, used tires, used electronics, and pharmaceutical waste collection event. That's going to be on Saturday, November 9th, from 8 a.m. to noon. It's going to be at the Precinct 4 Maintenance Yard, County Yard 104 Mesquite in Stockdale. We're going to be taking household hazardous waste, so paint, oil, antifreeze, that kind of thing. We're also going to be taking used tires, passenger tires only, no tractor tires or big truck tires, and used electronics and pharmaceutical waste as well. So just wanted to say thank you to the county for parks funding, and also to the Alamo Resource Conservation and Development Area for they are channeling some TCEQ supplemental environmental project funds to the event as well. So appreciate that. But I have flyers. If any of you would like to take some flyers and pass them out in your community, we'd appreciate that. And thank you very much.
Did you announce the time?
Yes, 8 a.m. to noon.
I want to be sure everybody got that.
Thank you.
Commissioner White on the rest of that one?
We're going to skip on down to item 12, Brian Burnside, Congress Memorial Medical Center, update on hospital activities, health services throughout the county.
Thank you, Judge. Appreciate it very much. Thrilled to have the opportunity to visit with the Commissioners Court and the public today to share a little bit about what's been underway at Connie Memorial Medical Center over the course of the last little bit of time. Many of you know that I'm Brian Burnside. I'm the new CEO. I'm the new guy in town. I've been here for about 120 days and have been absolutely thrilled with what I've seen here in Wilson County, what I've seen with our organization, and what I see for the potential future for healthcare services throughout Wilson County. What I wanted to do for just a few minutes, no more than 3 hours, is talk about what's going on here in the area in regards to health services and let you have a sense of what's up at the hospital. So if we just get started here, I'll share with you a couple of items. You can imagine being a new hospital CEO. I apologize, can y'all see that? Show the lights just a little bit. Wow. We're going to be just like at the movies. Just like at the movies, right? Over the course of the last few months, you're a new hospital CEO. What you try to do is you try to meet a lot of people. And I've tried to do that over the course of the last 120 days. I spent a lot of time with our employees, doing employee open forums, talking about what's going on at the hospital, meeting with our medical staff, meeting with my executive team, and also trying to be out and about throughout the community, talking with folks about what the health services needs are throughout the area. It's been a very busy couple of months, but pretty rewarding over the last 120 days. But let me share with you what I've learned. What I've learned is that County Memorial Medical Center has just an absolutely wonderful team. We've got a great team of employees. We've got a solid medical staff. We have a visionary board that is really committed to improving the hospital and expanding healthcare services throughout the county in the future. And we have a number of volunteers that work with us both inside the hospital and through the Consolata Foundation. Really having that great team is of crucial importance to me as the organization's leader, because I want to know that we have good people in place to provide excellent health care, and I've deemed that out over the course of my last 120 days here. Many of you know that the hospital's made some significant improvements over the course of the last couple of years. It's fair for me to say that there was a period of time the hospital went through some difficult times. But I can tell you from my professional opinion what I've seen over the course of the last couple of years in terms of the improvements have been fairly dramatic, and I want to share some of that with you in just a little bit of time. But what I'm really excited about is that the hospital has all the elements of success. If you've been to the facility, you know it's absolutely beautiful. We're very fortunate to have a facility of that nature here in Wilson County, and know that it creates a comfortable atmosphere for patients and their families when they seek care with us. Certainly you all have experienced the impact of being in a growing area. Floresville and all of Wilson County is growing very rapidly, and that certainly helps us in terms of the healthcare industry. But also what I think we've established as one of our elements of success is that our board and hospital leadership has a real vision for the future, and I'm going to share a little bit about that with you here over the next little bit of time. The other thing that I've learned in the last 120 days is that an Iowa family can survive a dramatic climate change. I came here from Iowa where on May 1st, 2013, we had 12 inches of snow and the wind chill was below zero. Fast forward 4 months, my family is here, and of course the heat index on August 1st was 110. So we can definitely prove that things are, we can survive that. Absolute shameless attempt to put my family up on a big screen. They're a big part of what we're doing here in Floresville. What I've been talking about with our board and our employees is that I believe professionally that hospital turnarounds go really through 3 phases. And over the course of the last couple of years, we've been in phase 1 of a hospital turnaround. In phase 1, we spent a lot of time as professionals focusing on cost control, focusing on resetting the priorities of the organization, and getting it on a different path. What I've been very excited about is that I can prove that the organization is coming out of phase 1 of the hospital turnaround, coming out of the idea of that heavy operational focus. We're moving into phase 2, and this is what I wanted to be able to share with the commissioners and the public, is that we're moving into phase 2, which is all about organizational growth. We're trying to expand the services that we offer here throughout the county and really focus on how we take this organization that's now back in balance and grow it to meet the needs of Wilson County. Ultimately, in the upcoming years, we'll really be focused on collaboration, how we work with all the members of our local medical community to work together, and that's another part of our process that we'll be developing out over the next couple of years. 2 slides to prove to you, though, that we have gone through a hospital turnaround phase 1. If you're a new hospital CEO, one of the things that you look at right off the front is you want to look at a lot of data. You want to understand what's going on. And this is a chart that I asked to be put together that looks at the hospital's revenue and expenses all the way back to 2009. And there was a period of time where our red expense line was north of our blue revenue line. There was a period of time where our expenses were north of our revenues, not including the county tax money that we receive and appreciate very much from county taxpayers. That's not where those lines are supposed to be. Over the course of the last couple of years, you've seen that we get to this moment in time where our blue revenue line is just barely north of our red expense line, as it's supposed to be. So that moment in time where those two lines cross is a positive moment for our organization, where we say we're no longer using county tax dollars to support our operations. We're able to use the county tax support that we receive and graciously appreciate to grow our business, to invest in capital equipment, and to prepare our organization for the future. So pretty exciting to see those two lines cross. This is,
When did that happen?
I'm sorry?
When did that happen?
Those two lines crossed about August of last year. For those of you in the room who are accountants and like to see numbers, what I want to do is show it to you in a different way. The hospital's audited financial statements in 2010 showed a loss of $2.1 million, an operating loss of $2.1 million. As we complete our budget for 2014, we're budgeting a $500,000 gain for a 12-month period. So pretty significant difference in terms of where we were operationally to where we will be or are as we make our budget for 2014. But the real story about the hospital's financial improvements really come down this line, which is our net assets. Net assets represent how much of yourself you own, so to speak, in terms of the liabilities and assets on your books. In 2010, the hospital net assets were $5.8 million. We're projecting as we close the year that we will have more ownership of ourselves, so to speak, and have net assets of $16 million. So dramatic improvement in the financial health of our organization.
What was the, you gained $7 million in total assets. Just curious, where did that come from?
Really what this is better collection practices, working better with turning our patient visits into cash, and also just simply better management in terms of making sure that we are operationally successful. So we've gone from a period of time where we were having multi-million-dollar losses to reaching a point where we've been able to gain some points.
And then you use some of that to pay down debt?
Exactly, yes, sir. What a great comment. For those who are really accounting inclined, this is a big portion of the improvements. At one point in 2010, we had quite a bit of liabilities and debt on the balance sheet, but we've been able to improve that over a period of time. So, like any business, paying down debt, paying down the liability is definitely a positive. The other piece that is just worthy of noting. In 2010, our effective tax rate to the residents was 0.1448. We just posted our tax rate for 2014 at 0.1146. So our board is very committed to trying to lessen the tax burden of the hospital to its residents, and has proven that now 2 consecutive years with lowering of the tax rates. Just a few more slides because I want to share just a few more points. Who's driven down Highway 181? Absolutely everybody, right? It's fair to say that we have a very competitive healthcare market. That hasn't maybe always been that way, but certainly we've seen that other businesses, new businesses are popping up throughout our community to provide healthcare services, and that there are a number of folks who are advertising in our community about their healthcare services. One of the things I'm very excited about is recently we've added a great marketing team of Lauren Marquin, Amanda Richardson, and Michelle Felix, who are going to help us to have a more apparent presence in our community related to marketing and the services that we offer. But the real opportunity that I'm particularly excited about is that our market has been growing, and that our hospital has not necessarily been able to serve as many folks as we would otherwise like. Imagine that you're a new hospital CEO. One of the first things that you do is you call the Texas Hospital Association and you ask for information about the market that you're coming into. Well, they shared with me a lot of information about this area, and they illustrated that in 2012, residents of this community sought $80 million of inpatient care. The reality is that only $10 million was provided by Conley Memorial Medical Center. Now, in fairness, there is a lot of high dollar neurology, high dollar cardiology that take place in some of the hospitals in San Antonio. But we know that we can do a great job providing for pneumonia care, providing for a number of other services that folks would need inpatient admissions for. And we haven't been serving our market as well as we could have been in the past. My belief as CEO is, golly gee, if I pick up 1% of an $80 million market, we've improved the financial health of our organization by $800,000. If I can provide services to 5% of the market that I'm not currently providing services to, we've improved the financial health of our organization by $4 million. So really trying to suggest that what you're going to be seeing from our hospital, now that we're back in balance, is really trying to reach out and provide the services that the community wants and needs. Are you with me so far?
Sir?
Yes, sir.
Here a while back, attended an event there at the hospital where he was partnering with Baptists on stroke, and you're transferring the people, which is the right thing to do,
You bet.
to them. How does that show up on your bottom line there?
That's a great point. Just about 3 months ago, we announced a major partnership with a health system in San Antonio to provide telestroke care. And previously, if you were a resident of the community that was experiencing a stroke, you would automatically be flown to San Antonio to receive your care. The problem was that there are a number of things that we can do in our emergency room very quickly, like applying certain medications and other protocols that can help make a difference in that first 15 minutes of a stroke being diagnosed. So we entered into a partnership with the health system to create a telestroke program that allows us to do a lot of that here in San Antonio. It doesn't reflect in these numbers, Judge, but will be reflecting in the numbers that come out in the future. Great point. Great point. Very excited about that program. So far, we've had over 30 people who have benefited from that program, and we know fact for fact that we've saved at least 4 lives related to that program in and of itself. So great. As I look to the future, just want to share a couple of items that's helping lay out what our focus is with our board. Number one, we are focusing on providers and services. Really, any health care organization is dependent on the strength of its providers, and we're really aggressively trying to pursue the best providers that we can possibly receive. Operationally, we want to make sure that we're doing the best we can with our financial resources. We want to be engaged with our community, and we want to begin to talk about industry trends and healthcare reform. Healthcare reform is upon us, and as an organization, we have a lot to do to get ready for the future. Only a few more slides to go, but I hope I'm sharing with you a good reintroduction of the hospital. This is our 2014 budget. And the reason I'm sharing this with you is because there's a fact on here that many people have just been blown away as I've shared this. We are clearly a hospital, and hospitals are defined in a lot of ways by folks staying overnight, receiving inpatient care. That's definitely a big portion of the work that we do. But if you look at our overall gross revenue, $72 million, we are like every other healthcare organization in the nation, where the largest portion of our revenue comes from the outpatient services. Laboratory, radiology, emergency departments, etc. Inpatient's a major portion of what we do, but certainly it's not the way that many people seek healthcare today, really a lot of outpatient services. What's also interesting is in 2014, we've added a new small business, and that's our clinic system. In the past, we have not had physicians who have been employed by the hospital, and we've over the course of the last year, brought on a number of docs to serve the community. That represents almost 10% of our total budget is the services provided by our employed physicians. What I'm going to show you here, it illustrates the growth that we're experiencing. In August 31st of 2012, just a little over a year ago, we had 0 employed physicians, none. September 1st, the very next day, Dr. Peterson joined us in terms of family practice, and Dr. Nyack transferred his practice over to us. That was just a year ago. Well, fast forward to August of this year, we've added Dr. Ekmark, a great family practitioner from Lavernia, and Dr. Profena, a military retiree who has tremendous experience in terms of wound care. He started just August 1st. Fast forward 2 more months, and we had Dr. Hassan here in November, and Dr. Faulkner, an ENT provider, also in November. So in just a very, very short time, the face of our hospital has changed dramatically from no physicians employed with us to ultimately 6 in just over a period of a year. I don't want to belabor this, but this is the impact of that to our organization. Over the course of the last year, we were averaging about 300 patient visits to our clinic system over the course of the last year. But fast forward to the addition of Dr. Ekmark, the addition of Dr. Profena, ultimately the addition of Dr. Hassan and Dr. Faulkner, and all of a sudden our organization is expanding very, very rapidly and very, very dramatically. This is exciting. I think it's really a great path for our organization to be on. And what I'm trying to illustrate with this slide is that we're becoming a different hospital. That's what I'm trying to illustrate, that we're becoming a very different hospital that's going to benefit from the services provided by these doctors. But probably the biggest news that I'd like to share with you today, with just 2 slides to go, is that just last Thursday, the hospital board endorsed my plan to develop a Conley Memorial Medical Center Health Center in Lavernia. We have been in contact with that community for quite some time, and they've communicated to us that they'd like to see additional health services provided in Lavernia. So literally last Thursday, I received approval by the board to develop a health center of this nature in Lavernia, based on 3 key services. The first will be an urgent care type of facility that will have extended hours to 9 p.m. every evening, as well as weekend hours. And then simultaneously a specialty clinic that will have rotating specialists like orthopedics, cardiology, and other services going to the residents of Lavernia. This will be an item that you'll see quite a bit of discussion about over the course of the next month or so. And you'll see us execute this business plan that was approved literally on Thursday to expand our reach into Lavernia. Very excited about that. One of the things that I joked about as we look at the map of Wilson County, when I came to the hospital, one of the first things I did was I drove the entire county. And I joked that the last place that I saw the hospital's logo was when I pulled out of the parking lot in Floresville here. A little bit of an embellishment, but not too far from the truth. If you look at what we did August 1st, we mobilized the building that we had at 775 and 181, which we're calling our North Campus. Dr. Peterson was just relocated there, and her practice is booming at that location. She's really been seeing a lot of growth. And then fast forward just a few months as we opened the Urgent Care Center and Health Center in Lavernia, you see that suddenly we've expanded our access quite dramatically throughout the area of Wilson County. Certainly we have other areas that we need to serve, Stockdale and Pope and other areas, but gosh, for 120 days I don't think that's too bad to begin to make that expansion to the residents of Wilson County. The reality is that you all pay taxes, and you support the hospital with your hard-earned money. So we wanted to make sure that we're expanding the access to services throughout the area. My last slide is just to say that I've been very proud of the employees over the course of the last 120 days. I believe very strongly in being active in the community. I believe that we are a major employer in the area, and I want to make sure that our employees and all of us are giving back. Over the course of the last couple of months, we've had a few fun events. Obviously, we had some chamber mixers, Chamber of Commerce mixers at the hospital, trying to get reacquainted with community leaders. Just last week, hospital employees raised $1,330 for breast cancer awareness through a Go Pink Day. It was great to see that type of participation. And literally on Saturday, myself, Dr. Faulkner, Dr. Eckmark, and about 20 other people walked in the Peanut Festival Parade. We were fishing for your good health. So just really trying to illustrate that I believe as a leader being involved in the community is very important, and we've been trying to illustrate that over the course of the last 120 days. Apologize if I've taken too much of your time, but I wanted to share with you a little bit about what's going on at the hospital. I'm very excited about it. I feel that we have a lot of work to do to serve the county the way that we intend to, and I think you're going to see that over the course of the next little bit of time. I took these pictures. I know it's kind of silly, but literally my first week here in Floresville, we had a rain shower over the hospital, and golly gee, I walk out at the end of the day, and there was a rainbow over Conley Memorial Medical Center. So I thought that was probably a pretty good sign for a new CEO coming in on his first week. But just thank you for your time and attention, and for your support of the hospital. Hope that I shared some things with you that maybe you didn't really know was going on over there.
Anyone have any questions, comments? We appreciate it very much. It's been very informative.
Thank you for your time.
Good presentation.
Thank you. I'm just going to move this out.
Sure. Here, wait.
Thank you all for your time.
Thank you. Okay, moving on to item 3, certificate of completion. Item 4, Larry Wilder, Commissioner Precinct 4, 9 a.m. open health insurance bids.
Well, we have, as opposed to the last couple of years, we have a lot. What we're going to do today, Jan, do we need to log these? Are you going to make a log of them? Do we need to log these as we open them?
I can make a log of them.
We have in the past.
Okay,
Uh,
all right.